Patient's recovery after surgery is a long road. That's why doctors at Intermountain Medical Center are pioneering a new process to help patients recover. Dr. Mark Ott, the medical director at Intermountain Medical Center, joins us now. Good to see you.
Thank you. It's good to be here.
Well, when we talk about surgery, whether it's mild or if it's a very large, complicated surgery, there's always a little bit of downtime or recovery for that person.
Right. Most people want to get their surgery done. They want to get back to their life as soon as possible.
What are some of those complications that surgeons and doctors really hope to prevent?
Well, obviously death, but that's very rare.
Yeah.
But most people have pain. That's when we have to treat, and then getting their strength back, getting over fatigue, getting their bowels working if they've had abdominal surgery. Those are all issues.
All those issues you want to kind of put behind you and get back to your normal everyday life. What are you doing at IMC to make that change?
Well, we've had a pathway going now for about 7 years where we call it our enhanced recovery after surgery.
Okay.
And those patients come in, they're prepared before surgery differently. They don't have to fast as long as we used to make them fast. They can eat up, take liquids up until 4 hours before. They come in and have surgery with less fluids. We manage their pain with less narcotics. We get them up and walk them right after surgery. They start eating that night. And most of those patients end up going home somewhere between 2 and 4 days for what used to be a 6 to 7 day hospitalization.
Exactly. And so when you talk about giving them food sooner and letting them get up and walk, it seems like just kind of basic health lifestyle things that people need to do. When did you point out, or why did you point out that those two things were important?
You know, we just had a bunch of wives' tales. We used to stick tubes and keep people confined to bed, and people started being more bold and said, let's try this, and we found out that people actually do better when we let them be humans.
When you let them just get up and go. And not using as many narcotics seems to be working as well.
That's a big deal, because one of the side effects of narcotics is that it slows down your bowel function.
Okay, so folks are going home sooner. You're cutting that stay from 7 days to 3 days. What does that mean for healthcare costs for the hospital and for that patient?
So that's cut the cost of a typical bowel resection by about 40%. So what used to cost maybe $18,000 is $12,000. So that's a gigantic difference in healthcare costs.
Will you see this across the board, or is it particular patients with particular surgeries?
It's most pronounced in the people that have inpatient stays. So we're doing this on abdominal surgeries, we're doing it on spine surgeries, total joint surgeries. So the outpatient surgeries, those people are not going to see as big a benefit from those principles, but people who have to be in the hospital for several days, 2 or more, they get a big benefit.
So now we're using these best practices. We know that it's working. Do you anticipate more research coming in to change things even more, make it even better?
Oh yeah, we study all of this. We have 22 hospitals, and so we accrue thousands and thousands of patients a year, so we can test new things. We recently tested a medicine that cuts another day off of the hospital stay. So we can run all kinds of experiments that benefit our patients.
And that's one thing, if you're going to have a surgery, people always have to plan for that recovery time. If it's shorter, they can get back to work, get back to some of their fun activities. Dr. Ott, thanks for joining us today.
Thank you so much.
And we'll have all that information posted at goodforutah.com. Still ahead.